I'm here to inform you about atopic eczema. Eczema is a chronic skin disorder that involves scaly, itchy rashes. Atopic eczema is the most common type. Here are the causes. Atopic eczema is due to a hypersensitivity reaction, similar to an allergy, in the skin, which leads to a long-term inflammation of the skin. Eczema is most common in infants. Many people outgrow it by early adulthood. The condition tends to run in families. People with eczema often have asthma or hay fever too. The following can make eczema symptoms worse: allergies to pollen, mold, dust mites, or animals, cold or the flu, contact with rough materials, dry skin, exposure to environmental irritants, exposure to water, feeling too hot or too cold, fragrances or dyes added to skin lotions or soap, or stress. Here are the symptoms. Typical skin changes may occur: blisters with oozing and crusting, ear discharge or bleeding, raw areas of the skin from scratching, skin color changing, may or less coloring than the normal skin tone, skin abnormally dark or light, skin redness or inflammation around the blisters. Both the type of the rash and where the rash appears can depend on the age of the patient. In children younger than 2, skin lesions begin on the face, scalp, hands, and feet. It is often a crusting or bubbling or oozing rash. In other children and adults, the rash is more commonly seen on the inside of the knees and elbows, as well as the neck, hands, and feet. During a severe outbreak, rashes may occur anywhere on the body. Here are the signs and tests. Diagnosis primarily based on appearance of the skin, personal and family history. Treatment. Taking care of your skin at home may reduce the need for medications. Keep the skin moist, called lubricating or moisturizing the skin. Use ointments such as petroleum jelly, creams, or lotions 2 to 3 times a day. Moisturizer should be free of alcohol, scents, dyes, fragrances, or other chemicals. A humidifier in the home will also help. Avoid anything that makes your symptoms worse. This may include strong soaps or detergents, as well as chemicals and solvents. Sudden changes in body temperature and stress, which may cause sweating and worsen the condition. Triggers that cause allergy symptoms. When washing or bathing, keep water contact as brief as possible and use less soap than usual. Shorter, cooler baths are better than long, hot baths. Do not scrub or dry the skin too hard for too long. After bathing, it is important to apply lubricating creams, lotions, or ointment on the skin while it is damp. This will help trap the moisture in the skin. Medication. Antihistamine taken by mouth may help with itching or if you have allergies. Often you can buy them without a prescription. Some antihistamines can cause sleepiness, but they may help with scratching while sleeping. Most causes of atopic eczema are treated with medications that are placed directly on the skin or scalp, called topical medications. At first you will probably be prescribed a mild cortisone or steroid cream or ointment. If this does not work, you may need a stronger steroid medicine. You may need different strengths of steroids for different areas of the skin. Creams or ointments that contain coal may be used for thickened areas. Antibiotic creams or pills if the skin is infected. Allergy shots too. Expectations and prognosis. Eczema is a chronic condition, but you can control it with treatment by avoiding irritants and keeping the skin well moisturized. In children, it often clears beginning around age 5 to 6, but flares up will often occur in adults. It is generally a long-term or recurring condition. People with eczema tend to have dry skin that flares up more in the winter when the air is cold and dry. Complications. Infections of the skin caused by bacteria, fungi, or viruses, and permanent scars. Call your doctor. Call for an appointment with your doctor if eczema does not respond to moisturizers or avoiding allergens, symptoms worsen or treatment is ineffective, you have signs of infection such as a fever, redness, or pain. Prevention. Studies have shown that children who are breastfed until age 4 months are less likely to get eczema. If the child is not breastfed, using a formula that contains processed cow milk protein called partially hydrolyzed formula may decrease the chances of developing eczema. Eczema tends to run in families, and keeping the skin well moisturized and avoiding irritants is important.